Hi, this is Akira Sanchez, and I'm going to do a skeleton practical for instructor Greg Johnson for Biology 163 Basic Anatomy and Physiology. We're first going to start with the step. Here we have what's called the frontal bone, this area right here. And then if we turn to the lateral view, you'll see that we have what's called the parietal bone. And then inferior to that, we have what is called the temporal bone, this area right here. And then on the anterior to that, we have what's called the sigmoid bone. It's like a small bone right here, but really in the inside, it's like a butterfly-shaped bone, if you were to open the skull up. And then anteriorly to that, we have what's called the zygomatic bone. And attached to the temporal bone, we have what's called the zygomatic process. And that bridges over to the zygomatic bone, and that is what we call the zygomatic arch. Now, looking at the interior view of the skull, we're going to look for the ethmoid bone. Now, if you looked into the nasal cavity and you were to you would find what's called a nasal septum. And the upper portion of the nasal septum, you have what's called the middle and the superior concha. And that makes part of the ethmoid bone. Now, if you were looked into the eye orbit, and you look into the innermost of the eye orbit, towards the nasal cavity, you would also find parts of the ethmoid bone. And if you were to open up the skull, you would find also parts of the ethmoid bone in this little region right here. And also you would find portions of the sphenoid bone, which is like a butterfly shape, which is just right here. Now the maxilla is bone right here. It's like inferior to the nasal cavity. And then you would have here the mandible, which is inferior to the maxilla. And then if you were to look for the hyoid bone, it would be like underneath the mandible. And just so you know, the hyoid bone is not attached to any bones of the skeletal system, but it is attached to the tongue. Okay, now let's go over the vertebral column. The vertebral column consists of 5 different regions. First, we have the cervical vertebrae. Then we have what's called the thoracic vertebrae. Then we have what's called the lumbar vertebrae, the sacrum, and then we have what's called the coccyx. The cervical vertebrae consists of 7 vertebrae, and that includes the axis and the axle. And those 2 bones are what holds up the skull, attaching themselves to what's called the foramen magnum. And the axis and the axle what helps us say yes and no. Okay, now the thoracic cervical consists of 12 vertebrae, and we will refer to that as 1T to 112, T12 for the thoracic vertebrae. And then the lumbar, we will refer to them as the L1 through L5. Now, if you notice the spinous processes for the cervical vertebrae are divided into 2, and they're smaller, and the direction facing like horizontal. And then if you go towards the thoracic vertebrae, you'll notice that the spinous processes enlarge, and they're much more downward. They face more the direction is more downward. And then when you go towards downward to the lumbar, you notice that the shape of the spinous processes they change. They're less downward. And then as you go toward the sacrum, you'll see that the bones infuse. And the first 4 infused bones of the sacrum are called the median sacral crest. Okay, now let's talk about the thoracic cage. Here we have what's called the sternum, and the true ribs and the false ribs. Now, the first 12 ribs are what we call as true ribs, and they are attached directly to the sternum by cartilage. The rest of the bones are called false ribs, and except for the last 2, all of them are attached indirectly to the sternum by the cartilage of the last true rib. Now, the sternum consists of what's most superior part is called the jugular notch, and that, as you can see, has attached to it our clavicle, bones, and the jugular notch is superior to what's called the manubrium, and then superior to that we have what's called the xiphosternal joint. And then after that we have what's called the body of the sternum, and then we have the xiphoid process, which is like a sword-like process. It looks like a sword. And now the thoracic cage is what protects our heart, our other vital organs like our lungs, and so on. Now let's talk about our upper limbs. Here we have what's called the scapula on both sides, scapula, and this is only attached to the skeletal system by the clavicle bones, as you can see right here. And like I said, the clavicle bones are attached to the skeletal system by the jugular notch. And then attached to the scapula bones, we have what's called the humerus bone. This right here, humerus bone. And attached to the humerus bone, we have what's called the ulna bone, this bone right here, which is medial to the body. And then we have what's called the radius, which is lateral to the body. And attached to these two bones, we have what's called the wrist. And the wrist consists of carpal bones, 8 carpal bones. And then attached to the carpal bones, we have what's called the metacarpals. And the metacarpals have attached phalanges, which we call fingers. And each finger, except for the thumb, has 3 separate bones. Well, I mean, they have joints, but 3 bones, and the thumb has 2 bones. Now let's go to the pelvic girdle. The pelvic girdle consists of the sacrum and the coccyx, and the coxal hip bones. Now the coxal hip bones consist of the ilium and the ischium and the pubic. On the superior margin of the ilium, you have what's called the iliac crest, and then you have on the formed by the sacrum and the coxal hip bones, you have what's called the pelvic brim. This right here, this is like the inlet, the pelvic inlet. And then here we have the ischium, and then here between the the ischiums towards the center, anterior to the vertebral column, you have what's called the pubic symphysis. And then closer to the ilium, you have what's called the pubic tubercles, and then closer, more medial to the pubic symphysis, you have what's called the pubic crest. Now let's go to the lower limbs. Here we have what's called the femur bones, and then here attached to the femur bones we have what's called the tibia, this larger bone, and then it's medial to the body, and then lateral side we have what's called the fibula, a small bone right here. And then attached to these 2 bones we have what's called tarsal bones, which consists of our ankles and our heels. And then on the dorsal side of our foot we have what's called the metacarpals, and then attached to the metacarpals we have what's called the phalanges also. And yeah, I think that's about it for the skeleton practical. Okay, thanks.